I'm Paul Kingston, and I teach anatomy here at UCSD. I'm excited to join the California Medical Scholars Program, offering a series of workshops on actual, real human anatomy. I created this presentation on a brief history of anatomy for a course I teach to first-year pharmacy students, hence the title slide and references to P1 anatomy. But I think this video might help you too. I look forward to seeing you in lab. But before we go there, I want you to understand what we're getting into and why. You will not be assessed on this presentation, but my hope is that after viewing this video, you'll be able to state the importance of anatomy, describe how the history of anatomy informs current practice, and summarize modern guidelines for human dissection. Anatomy is one of medicine's most ancient disciplines and underlies all patient care. You cannot treat patients without some understanding of anatomy. That's why anatomy is so important. In the beginning, ancient humans learned anatomy through hunting, fighting, and sacrifice, and depicted this knowledge in their art. We can infer that they deduced the functions of major organs by inspecting wounds and examining hunted prey. For example, they knew that skin provides protection and thermoregulation, and they used it for clothing. They must have known that muscles generate movement and that they are a rich source of protein. They knew that bones provide support and protection and used them to make tools and weapons, and that marrow was a rich source of lipid. And they must have known that the brain and spinal cord control movements and consciousness, and prized them as a rich source of protein and lipid. The fossil record demonstrates holes bored in prehistoric human skulls with evidence of subsequent bone growth, indicating that the patient often survived post-procedure. This was called trepanation, and it persisted past the dawn of written records. From these records, we know that the procedure was performed to relieve elevated intracranial pressure following head trauma, and to release evil spirits, probably from victims of neurological or psychiatric disorders like epilepsy or schizophrenia or dementia. We still perform essentially the same procedure today, for the former reason, not so much for the latter. In the ancient Fertile Crescent, clerics studied the internal organs of sheep sacrificed to predict the future. Observe on the underside of this clay model of a sheep's liver, the gallbladder. On the right, this famous work of art depicts the result of a royal lion hunt, indicating paralysis of the big cat's rear limbs following spinal trauma. The ancient Egyptians gained a superficial knowledge of anatomy from mummification. The deceased's lungs, liver, intestines, and stomach were preserved in clay jars. They placed the lungs in a baboon jar, the liver in a human jar, the intestines in a falcon jar, and the stomach in a jackal jar. They left intact the heart, which they considered the seat of the soul. The brain they extracted through the nose and tossed. It was considered useless for the afterlife. The ancient Egyptians knew much about the structure of the body's organs, but got many of their functions wrong. Nevertheless, they practiced medicine, including simple non-invasive surgeries and extensive use of pharmaceuticals. Archaeologists have recovered papyruses describing the diagnosis and treatment of many pathologies, such as those listed here. The ancient Chinese also studied anatomy and developed medical practice. For example, they pondered circulation and proposed that circulation in the limbs was balanced according to principles of yin and yang. This is arguably closer to our modern understanding than anyone else came at the time. The Chinese also formed a lot of numerological associations. They associated the 4 limbs with 4 seasons and 4 compass directions. There were 5 major internal organs that they associated with the 5 visible planets, and 365 meridians, or anatomical pathways, that they associated with the days of the year. These meridians are described in ancient Chinese Mawangdui texts at a level of anatomic detail that could only be discerned by dissection. I'll say that again for emphasis. There's no way they could have known all this without dissecting. These meridians eventually became guidelines for acupuncture. In ancient India and other parts of South Asia, a form of medicine called Ayurveda developed. It's regarded today largely as pseudoscience, but has a significant surgical component informed by anatomy. The Sushruta Samhita is a text describing ancient surgical tools and practices, including those listed here. Now, there's no firm record of dissection performed at this time, but as an anatomist looking at this list, it's hard for me to imagine that they didn't do some prior dissection perfecting these techniques. The ancient Greeks contributed much to our modern understanding of anatomy. I'll highlight the contribution of two individuals, starting with Hippocrates, who established medicine as a profession. He used observation to guide his medical practice, emphasizing the importance of taking a medical history from the patient, relating the patient's symptoms to the diagnosis of their disease, and seeking natural explanations for that disease separate from religion or spirituality. In short, the way that Hippocrates practiced medicine looks a lot like the way we practice it today. Next, Aristotle recorded systematic observations by dissecting non-human animals. He's basically the founder of comparative zoology. He also started a major branch of anatomy, embryology, with the first detailed descriptions of embryogenesis. It's important to note that neither Hippocrates nor Aristotle learned any of this from the dissection of human bodies, which was strictly prohibited in ancient Greece. About 300 years before the Common Era comes a major development, the first school of anatomy at Alexandria in Egypt. Early work at the school is dominated by two figures. The first, Herophilos, dissects the human body systematically and scientifically to advance medicine. He dissects, and according to who you believe, possibly vivisects, the bodies of condemned criminals. The second major figure was Erasistratus. Called the father of physiology, Erasistratus related structure to function. For example, he's the first to correctly describe the function of the cardiac valves. The big takeaway from the school at Alexandria is this: the first documented dissections of the human body sanctioned by authorities, but only in Alexandria and only with the bodies of criminals sentenced to death. Hence, dissection is seen as a form of punishment. From ancient Rome comes one of anatomy's most towering historic figures, Galen, who was chief physician to the gladiators in Pergamum, a city in modern-day Turkey. Galen studied human anatomy by examining his gladiators' wounds and supplemented that knowledge by dissecting non-human animals, mostly pigs and apes. This because in the ancient Roman Empire, it was forbidden to dissect the human body. Galen compiled all prior knowledge of anatomy that he could get his hands on. He experimented to relate structure and function, and then he published this in two major works with many findings. For example, he was the first to document that arteries carry blood, not air, which is trickier to figure out than you might think. Galen's extraordinary work advanced the contemporary understanding of anatomy so far that it remained essentially unchallenged for 1,300 years. The knowledge gained by ancient Greeks and Romans was lost from Europe during the Dark Ages, but Islamic scholars to the east translated what they found from Greek to Arabic. They further advanced our understanding of anatomy at a level of detail that must mean they either dissected or very closely examined wounded or dead. Some examples include Ibn al-Nafis, who correctly described the pulmonary circulation. This had eluded anatomists for centuries. Al-Razi, who distinguished nerves from tendons. The etymology of the word neuron is revealing. It comes from a term meaning sinew. So nerves, tendons, sinews, they're not necessarily that easy to tell apart. Ibn al-Haytham studied the anatomy of the eye, and over here on the right you see a figure from one of his texts indicating the eyes in their orbits, with the retinas innervated by the optic nerve. Anatomy returns to medieval Europe when Galen is translated from Arabic back into Latin, and later from Greek into Latin. In 1235, the first medical school is established in Europe, specifically southern Italy. About 100 years later, the first officially documented autopsy is performed. About a century after that, the first public dissection is noted in Europe. These dissections were often performed in anatomic theaters, like this one on the right, constructed in Padua, Italy in 1595. Note the person in this image to give you a sense of scale. These tiers are very steep and very narrow, only about 40 centimeters wide. They would pack up to 250 people into this theater, all craning their necks to observe the dissection taking place down in the center. At this time, dissection was officially sanctioned, permitted for education, and despite the passage of 1,300 years, Galen still dominates. To this extent, imagine a dissection taking place in this theater with one anatomist dissecting a body and another reading from Galen. If they find a discrepancy, they blame the body. That brings us to Renaissance Europe, where many people made great contributions to our understanding of anatomy. I'll describe just two of them, starting with Leonardo da Vinci, who studied human anatomy in support of his art. As he developed his skills, he relied increasingly on direct observation of human structure to inform his ability to draw it. And he dissected many bodies until he was ordered to stop by the Pope. This quote from da Vinci underscores his belief that you can't just describe the form of the human body in text, you've got to draw it to know it properly. And as an anatomist, looking over here on the right, I have to say, this guy could draw, and he knew his anatomy. This underscores a theme of this presentation, that art and anatomy are forever intertwined. If you go back to the beginning of this presentation, there's an early slide from a cave painting that was done 44,000 years ago. From then, all the way to Da Vinci, all the way to today, a modern illustrator who wants to draw the human form will often develop their skills by taking a course in human anatomy. You have to know the structure of the body to be able to draw it well. The other towering Renaissance figure is Andreas Vesalius. Born in Belgium, Vesalius moves to Padua to join the faculty there and study anatomy by dissection without fear of persecution. He dissects, draws what he sees, and publishes De Humani Corporis Fabrica, arguably the most famous anatomy text in history. De Fabrica, as it's often called, contains many detailed drawings showing anatomy exactly as Vesalius sees it. Drawing for drawing, Vesalius challenges Galen and eventually displaces him. 1543, the date of publication of De Fabrica, marks a turning point in anatomy. From that point forward, human anatomy is studied by direct observation from dissection of the human body. This image from the cover of De Fabrica deserves close inspection. Here's a large crowd watching a public dissection. They're climbing the walls trying to get a view. Here's a skeleton for reference. Here are two individuals fighting about something underneath the table for some reason. Over here there's a monkey. This person brought a dog. Note, we don't do that today. No animals allowed in the dissection lab. In the center of it all, we have a cadaver and a dissector, Vesalius, looking out as if to say, Galen, I'm taking over. Over the next 200 years, anatomy advances further in Western Europe, but there are also setbacks. In England, the Murder Act passes in 1752, stating that condemned criminals can be hanged and then dissected. Note here the theme in which dissection of the human body is regarded as a punishment inflicted beyond death. This painting by William Hogarth illustrates this theme. In it, a fictitious villain named Tom Nero has been hanged and suffers dissection post-mortem. Note the horrified expression on Tom Nero's face, the leering grin of an anatomist as he probes the orbit. Note Tom Nero's entrails being pulled unceremoniously into a bucket. Note the dog eating loose scraps. We definitely do not allow that in lab today. Despite the Murder Act, the demand for cadavers exceeds the supply, and a black market develops in which resurrectionists dig up corpses from graves to sell. This situation becomes critical in Edinburgh, Scotland, with Burke and Hare. Burke and Hare are resurrectionists who, I guess, figure that it's too much work to dig up bodies from graveyards, so they murder 16 people. I believe the victims come from a low-rent hotel that they help manage, and they sell the bodies to Dr. Robert Knox. In 1731, Burke and Hare are caught. Hare turns king's evidence against Burke. Burke is convicted, hanged, and, in an ironic twist, publicly dissected. Hare, given immunity for his testimony, is run out of town. But the next place he goes to, he's recognized there, and he's run out of that town too. And from there, he disappears into history. No one knows what happened to Hare after that. Dr. Robert Knox basically gets away scot-free, except not. His career goes into decline, and he is somewhat shunned after this incident. In 1832, the Anatomy Act is passed to ensure a legitimate supply of cadavers from unclaimed or donated bodies. Note the difference here. Human dissection is now decoupled from postmortem punishment, and bodies are decommodified. You can't buy or sell them for profit. Great strides are made in our understanding of anatomy in the 20th century, but not without some setbacks. Consider the Pernkopf Atlas from 1937. Authored and illustrated by members of the Nazi Party over many years, scholars looking back have reached the inescapable conclusion that some of the bodies used to produce the atlas must have been prisoners executed by the Nazi regime. Much more recently, the Body Worlds exhibition. In 1995, Günter von Hagens perfects plastination and uses the process to display human bodies, sometimes in very sensational poses, and in some cases possibly without their consent. That leads to a major principle of anatomy today: we do not dissect without the prior informed consent of the donor. UCLA in the 1950s establishes the world's first willed body donation program. Note the difference between then and now. The body is no longer a commodity to be bought, sold, or stolen, but is rather a gift. But the program runs into trouble in 1993 when it's found that workers have been canoeing, a term for the illegal disposal of medical waste hidden in cremated remains. Then, at UC Irvine in 1999, the director of their willed body program is fired for permitting illicit dissections and for the unauthorized sale of cadaveric tissue to private companies. And finally, again at UCLA in 2004, 2 men are convicted of the illegal sale of cadaveric tissue to private companies for personal profit. Those 2 men go to jail for several years. I can't let those remarks pass without adding the following. UCSD also has a willed body donation program. It's been scandal-free from its very first day to the present. Let's keep it that way. Which brings us to here and now. All of our donors have given their informed consent. No money is exchanged except to cover costs like transport, embalming, etc., and those costs are carefully regulated, as are the procedures for the preparation and use of our donors. Access to the lab is tightly restricted. This is our lab space with seating off to the left. The donors are off to the right, but I can't film them without explicit prior permission for video and photography. Modern anatomy is characterized by a theme of symmetric beneficence. That is, the donor performs an obvious good by providing their body to you for study, but you also perform an act of good by enabling the donor to help others beyond their lifespan. The ethical considerations that have shaped our study of anatomy over history are still debated today. For example, consider anonymity. Here at UCSD, all of our donors remain entirely anonymous. You cannot know the name of a donor you dissect. But other programs take a different perspective and allow donors to choose whether to reveal their name and even their story to those who may dissect them. Finally, consider dissection itself. It's certainly the very best way we know to teach anatomy and a hard-earned privilege. But I can imagine a day, perhaps many decades from now, when our imaging has become so sophisticated and our robotics so advanced that it might be possible to study the structure of the human body in great detail without dissection. Time will tell. I hope you found this presentation enjoyable and informative, and that it provides some context to help you understand why anatomy is important and how the history of anatomy has led us to the way we study it today. That's it. See you in lab.